One Health Institute in Uganda, Kampala, is taking a unique step to promote the maternal wellness and support mothers beyond childbirth. TMR International Hospital has officially launched the annual TMR Mama Run, a communal wellness event aimed at championing mental health and raising awareness about postnatal care challenges affecting the women as we continue with our Mental Health Month. The event is scheduled for Saturday, May 9th, ahead of the Mother's Day celebrations, and will take place in Nadia with routes extending through the Northern Bypass and beyond. Speaking during a press conference, the hospital's executive director, Dr. Daniel M. Talemwa, described the Mama Run as a more than just a fitness activity. He said the initiative is intended to unite families and communities in support of the mothers while addressing the critical mental health issues such as tears, obstetric fistulas, postpartum depression, and post-pregnancy body image challenges. Organizers say that the event is open to everyone, including the mothers, fathers, and children and grandparents, with 4 running categories designed to accommodate different fitness levels ranging from 3 kilometers to 21 kilometers. Participants will also receive free wellness services including blood pressure screening, BMI checks, HIV testing, cholesterol testing, and blood grouping. In addition, attendees will receive complimentary consultation vouchers with specialists in regenerative medicine and stem cell therapy. The event will also feature dance workouts, fitness sessions led by professional trainers, and a complimentary breakfast after the run. Meanwhile, consultant of the plastic and reconstructive surgeon, Dr. Martin Tujoto, highlighted the importance of postnatal restorative care, noting that pregnancy can bring major physical and emotional changes for women. He explained that the procedures such as tummy tucks, liposuction, and breast restoration treatments can help some women regain confidence and improve their well-being. Though these initiatives like the Mama Run Health experts hope to encourage more open conversations around mental health while reminding communities that supporting mothers goes far beyond pregnancy and delivery. So let's go support this, because it is something that is going to help our communities at large. Now, moving on to our other local story. Now, in a major breakthrough in HIV treatment that could soon transform the lives of millions of people living with the virus, not only in Uganda but across Africa. Ugandan researchers and health officials have revealed ongoing plans to introduce long-acting injectable HIV treatments that could replace the daily ARVs pills with injections administered once every 2 months. The treatment combines 2 drugs, cabotegravir and ripivir, and is designed to reduce the burden of taking daily medication while improving treatment adherence and viral suppression. Speaking about the development, Dr. Robert Mutumba, the head of the AIDS control program at Uganda Ministry of Health, said that the outlook is promising and expressing optimism that Ugandans could soon access the injectable treatment. Meanwhile, Dr. Sisi Chitio, the executive director of Joint Clinical Medical Research, highlighted the challenges many patients and people face in constantly taking the oral antiviral viruses, diseases, and the drugs every day. She explained that African researchers have been actively studying the injectable HIV treatment options and findings from a major African-led trial, and have already influenced the updated guidelines from the World Health Organization. According to the Phase 3B clinical trial published in the Scientific Journal for Nature Medicine, the injectable treatment performed just as an effective and daily oral medication. Researchers found out that after 96 weeks and 97% of the patients receiving the injections maintained viral suppression, matching the results among those taking the daily pills, meaning it can be highly possible. Experts believe that the introduction to the long-acting injectables could significantly improve treatment outcomes by making HIV care more convenient, reducing the missed doses, and lowering the risks of transmission. Health officials are now calling for accelerated production of affordable generic versions to ensure wider access once the treatment becomes available. According to the Uganda AIDS Commission, Uganda recorded approximately 37,000 new HIV infections and 20,000 HIV-related deaths in 2025, with around 1.5 million people currently living with HIV/AIDS. So if successfully rolled out, the new injectable treatment could mark a major shift in the HIV care, offering patients greater convenience, dignity, and hope in the long-term fight against this virus. Now, moving on to our next story. Health experts in Uganda are raising concern over what they describe as the silent asthma crisis, with thousands of patients reportedly living without proper diagnosis or access to life-saving treatment. So the specialist speaking during a national webinar organized at Makerere Lung Institute to mark the World Asthma Day 2026 have revealed that most Ugandans living with asthma remain undiagnosed and unable to access the recommendable inhalers. According to the Ministry of Health Director General of Health Services, Professor Charles Olaro, asthma affects about 11% of adults and nearly 18% of adolescents in Uganda. However, many patients only seek medical attention after symptoms become severe. Professor Olaro warned that misdiagnosis remains one of the biggest challenges, especially among the young children, where asthma symptoms are often mistaken for pneumonia or other respiratory infections. He revealed that up to 90% of the children under 5 showing asthma symptoms are incorrectly treated for pneumonia using antibiotics despite not improving. Doctors say that the consequences extend beyond health, so they affect school attendance, productivity, and also the household finances due to the repeated illnesses and hospital visits. Meanwhile, access to inhalers remain a high major concern. Health officials say that inhaled air, the recommended first-line treatment for asthma, are largely unavailable at lower-level health facilities where most patients seek care. Dr. Ellen Anyu, a senior pediatric consultant at Mulago National Referral Hospital, explained that asthma symptoms such as wheezing, recurrent cough, chest tightness, and difficulty in breathing are frequently confused with common infections. She warned that delayed diagnosis allows airway inflammation to continue, increasing the risk of severe attacks and also long-term complications. Experts also pointed to environmental factors such as air pollution, tobacco smoke, dust, and repeated respiratory infections as a major contributors to the rising asthma cases. And also affordability remains a major obstacle, with some inhalers reportedly costing more than 2 weeks' wages for the ordinary Ugandans. So according to the World Health Organization, asthma affects more than 250 million people worldwide and causes approximately 450,000 deaths annually, most recurring in lower and middle income countries due to the poor access to the treatment. Health experts are now calling for urgent investment in the diagnosis, affordable inhalers, and also stronger respiratory healthcare system to ensure that no Ugandan suffer or dies from asthma because of lack of access to proper care. Now moving on to our next story, and this is one from our neighboring countries here in East Africa. This is Tanzania, where health authorities have launched a major vaccination campaign aimed at protecting thousands of children from polio. In Mwanza, more than 170,000 children are expected to benefit from a large-scale polio vaccination exercise taking place in Lemera Municipal Council. According to the municipal health officials, the campaign is targeting all children under the age of 10, including those who received the first round of vaccination, as well as those who may have missed it. The second phase of immunization drive officially begins today and will run until Sunday as part of the Tanzania's ongoing efforts to prevent the spread of the deadly virus. Speaking during a community sensitization and training session, Lemera Municipal Public Health Educator Kalunde Gesima said that the campaign is focused in increasing awareness about the importance of the novel oral poliovirus vaccine type 2, commonly known as NOPV2. The training brought together religious leaders, elders, private school owners, and youth representatives to strengthen public education and encourage community participation. Health officials say that the trusted local leaders play a critical role in mobilizing the families and addressing fears of misinformation surrounding the vaccines. District Sheikh Abu Juma Abdul praised the government for involving community leaders, saying that the training had deepened their understanding of polio and the efforts. He pledged to work closely with the communities to encourage parents to ensure their children receive the vaccine. Meanwhile, market leaders and local stakeholders have also joined the campaign, emphasizing that protecting children's health is essential for both family and well-being of the economic stability. Health officials say that the widespread of the vaccination remains one of the most effective ways to prevent polio outbreaks and safeguard future generations from a disease that can cause lifelong disability. Now, I think this is something we should copy as a country so that we can also add up to the people fighting against this deadly disease. Now, moving on to our next story. As Africa continues to fight against malaria, health experts say that the progress is being made, but major challenges still threaten efforts to eliminate one of the continent's deadliest diseases. According to the latest World Malaria Report, malaria remains a major public health crisis, with Africa accounting for 95% of the global malaria cases and deaths in 2024. The report estimates that Africa recorded approximately 265 million malaria cases and 579,000 deaths last year alone, with children under 5 accounting for nearly 75% of all fatalities. Health experts say that countries including Nigeria and Democratic Republic of Congo and Niger continue to carry the heaviest burden. Health experts also say that despite the alarming numbers, researchers and global health organizations point to severe encouraging breakthroughs in the fight against the disease. One major deployment is the approval of the world's first malaria treatment, specifically designed for babies and very young children between 2 months and 5 years of age. Health experts describe the treatment as a critical step in protecting one of the most vulnerable groups affected by malaria. At the same point, malaria vaccination programs continue to expand across the continent here in Africa. 17 malaria endemic countries have already introduced vaccines into routine childhood immunization programs, including the RTS malaria vaccine and also the R2I Matrix M. Researchers say that these vaccines work best when combined with other prevention measures such as insecticide-treated mosquito nets, rapid diagnosis, and also effective treatment. Meanwhile, scientists are also exploring innovative approaches to malaria control, including the use of bacteria found in mosquitoes that help prevent the insects from spreading the malaria parasites. However, experts warn that climate change, flooding, and shrinking international funding continue to threaten the progress. Floods in particular create stagnant water where mosquitoes breed, increasing the risk of malaria outbreaks in vulnerable communities. Health experts also caution that reduced funding for malaria programs could reverse years of progress, stressing that prevention remains far cheaper and more effective than treatment. So as the world marks ongoing efforts to end malaria, experts say that stronger investment, scientific innovation, and community action will be critical in turning the dream of malaria-free Africa into reality. So those are our news updates for today. Thank you for tuning in and thank you for staying as we are still continuing with your health show. But right now, let's take a short break and then we'll come back with an expert discussion where you're going to learn something.
Amateka, Mukama.